On March 11, 2020, the World Health Organization officially announced COVID-19 as a pandemic. The disease has infected more than 1 million people and has killed over 74,000 people worldwide.
The Italian government has put about 1/4 of its population under quarantine.
The army building makeshift hospitals for patients as Spain's numbers surging even more. And in Britain, pubs, restaurants, gyms, all shut.
U.S. President Donald Trump on Saturday said he's considering imposing a quarantine on New York and other states.
Several governments and healthcare professionals recommend that we use social distancing and self-quarantine to help slow the spread of the disease. Social distancing is deliberately putting space between you and others, at least 6 feet away. Self-quarantine is recommended for those who might have been exposed to the disease and are at risk of spreading it. A common trend right now to help describe the need for these precautions is a graph measuring the amount of people infected at once and the amount of resources we have to nurse them. So we've heard the phrase flattening the curve. What does that mean?
In reference to flattening the curve, it's referring to a graph. The graph is the y-axis here, which is a population that could be infected, and then you have the x-axis here, which is a set time frame of how quickly people are getting infected. The two kind of curves that illustrate, there's a steep one, which is people getting infected really fast in a short period of time because we're not doing anything. Flattening the curve is due to social distancing, quarantine, and that's what we can do to slow the spread of COVID-19. The purpose of flattening the curve is so that we don't go above this dotted line that's on the graph, and that dotted line is what hospitals and healthcare facilities can, what they're able to accommodate, so we don't overwhelm the healthcare system.
And the longer-term projected U.S. death toll is now 60,000, down from 93,000 just a week ago, due in part to the success of social distancing.
A toda la Argentina deberán someterse al aislamiento social preventivo y obligatorio. Esto quiere decir que a partir de ese momento nadie puede moverse de su residencia.
There's no doubt that we are now bending the curve, and there's no doubt that we can't stop doing what we're doing. That's the good news.
Eso lo que permite es como aplazar esa fase acelerada. En vez de pasar de tener 5 casos en un día a tener en 48 horas 150 casos, por decirlo así, le permite al sistema de salud poder evolucionar los pacientes que están graves y que esos pacientes puedan pasar a sala y no generar un colapso del sistema. Que fue lo que pasó en realidad, fue el problema que tuvo Madrid y Milán. Lo que más afectó la mortalidad en esos lugares, de que muriera la gente así en 500 personas por día, como estamos escuchando en todos lados, 800 personas por día, que es un disparate, es que en realidad el sistema desde los recursos humanos y desde los recursos materiales, de tener 10 pacientes pasarán a tener 500 pacientes, no había espacio, no había ventiladores, no había lugares adecuados, porque eso es otra cosa. A nivel de la terapia intensiva, lo ideal es que haya un médico cada 4 pacientes o cada 3 pacientes.
This is an effort that involves everybody. Hopefully have people social distance, self-quarantine, not just to prevent it from spreading, but to protect yourself. And it's to help like medical facilities from being overwhelmed. It's not something that can be accomplished by a handful of people. It's an effort from the community, from everybody.
It's so important that we all work together. We are all responsible as citizens to slow down the spread, to take the pressure of health systems so that all patients, not only those with COVID-19, can have access to optimal health care.
Porque es momento de que todos hagamos un esfuerzo.
The only way to really overcome such challenge is to work together hand in hand. Working together, sharing the knowledge in a transparent manner to overcome through vaccines and through treatment and to able to control and contain this pandemic.
Así que no es que le ganamos al coronavirus ahora y nunca jamás más lo vemos.
Claro.
Quedan como pequeñas cosillas, pero bueno, en realidad el tema es que el sistema de salud lo aguante. Lo que le afecte al otro también me afecta a mí. Digo, ya sea lo de la salud, ya sea la gran crisis económica que viene atrás de esto, como el hashtag de esto salimos entre todos, es así.
I am grateful for truck drivers and people that work at grocery stores because it could be worse. We could be all on our own at our houses, but we have means to go out and get food and take care of ourselves. This is an effort that we all need to do. Like I said, there's no vaccine yet for COVID-19. This is how we can prevent the spread and prevent people from getting sick without there being a vaccine. Like, this is what we can do.